Welcome to This Explainer. Let's be totally honest for a second. How many of us are guilty of putting off our annual checkups? It happens to the best of us when life gets super busy. But today, we're going to completely demystify the physical exam process. We're looking specifically at how things work at Mederi Urgent Care in Los Angeles, breaking down exactly what tests are done, what they actually cost, and how you can prepare so you can walk in with total confidence.
Okay, let's dive into this because it's probably the number one question people ask. I feel perfectly fine, so why do I need a doctor poking and prodding me? Well, the reality is that some of the most serious health conditions out there, like high blood pressure, elevated cholesterol, and even early-stage cancers, often have absolutely zero early symptoms. You can feel like $1,000,000 while a hidden issue is quietly developing. A physical isn't just for when you're sick. It's a proactive tool to establish your baseline health and catch silent problems way before they become emergencies.
To get there, here's our roadmap for This Explainer. 1. The right exam for you. 2. Inside the exam room. 3. Unpacking the blood work. 4. Transparent costs and insurance. And finally, 5. Prepping for your visit. Section 1. The right exam for you. Finding your fit.
And this brilliantly illustrates how not all physicals are created equal. The type of exam you need really depends on your specific goals. There's a big distinction between the most common types. First, you've got the annual physical. This is your big picture, long-term prevention visit. It's all about monitoring your overall adult health and updating your vaccinations. Now, compare that to a school or work physical. These are highly focused on immediate safety clearances, like is your child healthy enough to play soccer? Or are you physically capable of safely performing your new job? They serve very different but equally important purposes.
Now, there's also a very specific kind of niche exam, the DOT physical. This is mandated by the Department of Transportation for commercial drivers or anyone working jobs that involve hazardous materials. Basically, this is the clearance you absolutely need to ensure both personal and public safety. If you're listening to this and you need to get behind the wheel of a commercial vehicle in Los Angeles, you are in the right place because Mederi handles these too. Even if you're just going in for a standard annual physical, your baseline needs definitely evolve as you age. From ages 18 to 40, the focus is largely on building healthy habits, STI screenings, and keeping those vaccinations up to date. As we move into the 40 to 60 bracket, the primary care focus shifts over toward screening for diabetes, heart disease, and cancers. And for folks 60 and older, doctors will really prioritize checking bone density and monitoring for cognitive changes. Proactive care really puts you in the driver's seat at literally any stage of life. Section 2. Inside the exam room. Opening the black box. Let's move to and see how this builds. So what actually happens when they finally call your name? Here is the chronological journey for a typical 30 to 60-minute appointment. At minute 0, it starts simple, vital signs like height, weight, and blood pressure. Around the 15-minute mark, your doctor reviews your medical history and performs a head-to-toe physical examination. And yes, that includes the dreaded cold stethoscope. At 30 minutes, it's time for lab work, usually just a quick blood draw and a urinalysis. Finally, around 45 minutes, you wrap the whole thing up with a discussion of the findings, lifestyle recommendations, and any necessary vaccinations. I really want to pause here and emphasize a stark fact. High blood pressure often has absolutely zero symptoms. Remember that very first step of the appointment we just talked about, checking your vital signs? That simple blood pressure cuff is one of the most powerful diagnostic tools in the room. Unchecked high blood pressure dramatically increases your risk of heart disease and stroke, which makes that simple baseline check incredibly vital. Section 3. Unpacking the blood work. What are we looking for? I know, the phrase blood draw immediately causes anxiety for some of us, but honestly, understanding exactly what the lab is testing for brings tremendous peace of mind. Let's translate all this medical jargon into plain English. The CBC and CMP, they just check your overall blood health and organ function. The lipid panel is literally just checking your cholesterol. Blood sugar tests, well, they scan for your diabetes risk, and the urinalysis is a super quick check of your kidney function. It sounds highly technical, but really, they're just scanning for the most common preventable issues. Another absolutely crucial test that's often included is the TSH, or thyroid stimulating hormone test. I wanted to highlight this one specifically because your thyroid directly controls your metabolism and your energy levels. If you've been dealing with unexplained fatigue, weird weight changes, or just general brain fog, this single simple blood test can very often provide the answer. It's actually amazing how much a few vials of blood can explain about our everyday lives. Section 4, transparent costs and insurance. No more guessing games. Now, what's really interesting about this next part is how it tackles a major pain point. Let's be real, the most stress-inducing part of healthcare usually isn't the needle. It's the bill. But at a place like Mederi Urgent Care, you know exactly what you're paying up front. An annual physical ranges from $150 to $300. But the great news is it's usually fully covered once your deductible is met. School physicals are very affordable at $100 to $200 and often insured. Work physicals range from $150 to $300, and hey, your employer might fully foot the bill for that. Lastly, the DOT physical runs between $150 and $250. Because it's a specialized work requirement, it's usually self-pay. But the pricing is totally transparent from the jump.
But here is literally the absolute best number you are going to hear today. $0. No joke. For a vast majority of people with health insurance, an annual preventive physical costs absolutely nothing out of pocket once your deductible is met. The healthcare system actually wants you to get this exam because it is so much cheaper to keep you healthy right now than to treat a severe illness later on.
Section 5. Prepping for your visit. Making it stress-free at Mederi Urgent Care. So the crucial point is, if you're in the Los Angeles area and planning to head over to Mederi Urgent Care, getting ready is incredibly simple. Step 1. If you're getting blood work for cholesterol or blood sugar, make sure you fast for 8 to 12 hours beforehand. Yes, you might be a little hangry, but it is totally worth it for accurate results. Step 2. Gather your medical history, your current medications, your ID, and your insurance card. Step 3. Don't forget any specific clearance forms you might need for school or work. And Step 4. Just walk into the clinic wearing comfortable, loose clothing. That is really the whole shebang. And what about after you leave? Honestly, the anxiety of waiting for test results is incredibly short-lived. In most cases, your lab results will come back within just a few days. You're only going to be asked to schedule a follow-up appointment if something concerning is found on those labs, or maybe if the doctor wants to discuss implementing healthy lifestyle changes, like nutrition or stress reduction, based on your baseline numbers. We hear this old adage literally all the time, right? Prevention is the best medicine. But the physical exam really proves exactly why that holds true. Catching health problems early is always better. It's less expensive, and it's infinitely more effective than trying to treat a disease in its late stages. It gives your primary care provider the chance to really know you over time, ensuring you get truly personalized care. So I'll leave you with this final thought. We've completely removed the mystery today. You know the exact steps, you know the costs, and you understand the tests. So, will you take control of your baseline health today? Don't wait for a symptom to tell you something is wrong. Walk right into Mederi Urgent Care, get your physical, and confidently prioritize your long-term well-being. Thanks so much for joining me for this explainer, and here's to your health.